Swollen lymph nodes in the chest, causes and treatment. Usually swollen chest lymph nodes are too deep in the chest for a person to feel them. Any swollen lymph nodes in the chest appear on imaging scans. Swelling can indicate an underlying condition. Along the collarbone, it may be possible for a person to feel swollen lymph nodes themselves. They sometimes swell when fighting an infection, especially in nearby areas such as the breasts or throat. The lymph nodes are an important part of the lymphatic system, which helps protect the body from disease-causing organisms such as bacteria. Swollen lymph nodes can signal an underlying condition such as an infection or cancer, but lymph nodes can also swell for no apparent reason. In this video, we look at the possible causes of swollen lymph nodes in the chest and their treatments. Causes of swollen lymph nodes in the chest. The lymph nodes are part of the lymphatic system, which helps to filter out harmful materials such as infections or cancer cells. This system includes a network of vessels, similar to blood vessels, connecting the many different lymph nodes. Lymph nodes sometimes swell when the body is filtering out something harmful. They can also swell for no apparent reason, either because of chronic health issues or due to lymph node diseases. Swollen lymph nodes may occur in a single location or throughout the body. The site of the swelling often provides clues to the source of the problem. For example, a person with a swollen lymph node in the neck might have a tooth abscess or strep throat. Mediastinal lymphadenopathy is the medical term for swollen lymph nodes in the chest. Swollen lymph nodes in the chest often mean a person has an underlying medical condition which could be serious. In a 2019 study of the 1075 people who underwent an endobronchial ultrasound guided transbronchial needle aspiration to diagnose swollen chest lymph nodes, cancer was the most common reason for the swollen chest lymph nodes, with 61.6% having some form of this disease. The potential causes of swollen lymph nodes in the chest include lung cancer. Swelling in the lymph nodes surrounding the lungs and in the chest may mean that a person has lung cancer or that lung cancer is spreading to other areas of the body. Lymphoma. Lymphoma is a cancer of the lymph nodes. It can affect lymph nodes anywhere in the body and may begin in the chest or spread to the chest from other lymph nodes. Sarcoidosis. Sarcoidosis is an inflammatory disease that can damage the lungs. The 2019 study found that it was one of the most common non-cancerous reasons for swollen lymph nodes in the chest. Tuberculosis. Tuberculosis is a serious infection that affects the lungs and may spread elsewhere in the body. It can cause swollen lymph nodes. Other infections, especially those that affect the lungs, may cause swollen lymph nodes. Examples include bacterial, viral, fungal, and parasitic infections such as pneumonia, HIV, histoplasmosis, and toxoplasmosis, respectively. However, mononucleosis, a viral infection, rarely causes the lymph nodes in the chest to swell. Other causes, other serious health issues such as heart failure or interstitial lung disease can sometimes cause swollen chest lymph nodes. Location of swollen lymph nodes. Except for the lymph nodes above the collarbone, the lymph nodes in the chest are so deep that a person cannot feel them. Most are located around organs and behind bones or other large structures. Many are behind the breastbone in the pleural space, which is the tissue lining the chest and surrounding the lungs. Others surround the main veins and arteries of the heart. For example, the para-aortic lymph nodes lie on the front and the back of the ascending aorta and aortic arch. As it is not possible to feel the lymph nodes deep in the chest by pushing on the skin, a person will require an imaging scan to determine whether they are swollen. Can you feel lymph nodes in the chest? It is not possible to feel the mediastinal lymph nodes as they are deep in the chest. Other chest lymph nodes are also typically too deep to feel. Doctors usually only notice swelling in these lymph nodes on an imaging scan. However, a person may be able to feel swollen lymph nodes at the collarbone. People with swollen lymph nodes in the chest may also experience swollen lymph nodes elsewhere, such as in the armpits, groin, or neck. Symptoms of swollen lymph nodes. People with swollen lymph nodes in the chest might not notice any symptoms. However, the swollen lymph nodes sometimes push on organs or other structures, which may cause pain. If an underlying illness is causing swollen lymph nodes, a person may have other symptoms such as feeling sick or weak, fever, cough or trouble breathing, swollen lymph nodes elsewhere in the body, unexplained weight loss, night sweats, pressure in the chest. Cancer of the chest lymph nodes. Lymphoma is a cancer in the lymphatic system or lymph nodes. It can begin in the lymph nodes of the chest or travel to these lymph nodes from other parts of the lymphatic system. Other cancers such as lung cancer may also spread, affecting nearby lymph nodes. A biopsy is the only way to diagnose cancer in the lymph nodes, but a doctor may also recommend blood work and imaging scans to evaluate the source of the swollen chest lymph nodes, the type of cancer a person has, where it began, and whether it has spread to other areas all help to determine the outlook. For instance, the overall 5-year relative survival rate for non-Hodgkin lymphoma is 74% with treatment. This means that 74% of people survive at least 5 years in comparison to others their age.